Wellness for Life is brought to you by Perham Physical Therapy, Sanford Health Clinic and Same Day Surgery Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave-Ottawa Community Action Partnership.
Hi, I'm David Gothenburg, and I thought a good subject today would be on pain. And so what I'm going to try to do is focus in on the type of pain that's associated with people that may have a meniscus tear, arthritic type pain in the lower back, or in some instances what happens when you tear the fibers of the disc. Some doctors call this a herniation. One of the most common questions we hear from patients is, why are my joints aging prematurely? Or why am I more prone to a disc injury or an injury to the meniscus of my knee? And really it's not that complicated. And I have a little example here. This basically shows a healthy lumbar disc. And this shows a disc that has begun to thin. Its width is changing. And really what happens to the disc as we age, or the cartilage in our knee, is that they become more cork-like. Cartilage is without blood, so as we age, the disc becomes more cork-like. Therefore, it's prone to either collapsing or, in some cases, tearing or fracturing. So, getting back to the subject title, pain, what we're finding, or what I'm finding is happening more often is of course, people want to be without pain, and medically it seems as though something that's increasing, is more prevalent, is steroid injections. And so people are getting steroid injections in their knee or in their low back. And while there is reasons for this, I can tell you some good reasons why you might want to consider it. Is number one, once you introduce a steroid into the joint, it stops the inflammatory process. That's an important process for long-term healing. The injection does nothing to repair or restore healthy tissue. It just stops inflammation. And perhaps the last thing is cortisone is caustic. It leaves some residuals. My approach, and I think most chiropractors' approach to helping someone with one of these problems is to improve function. And we do that by either supporting a person's posture from the foot upward. This may include wearing orthotics, and definitely by improving alignment and motion in the joint that we're concerned about. And the last thing we do is there are good things out there that we can use to actually feed the joint or feed the cartilage so that it repairs quicker and lasts longer. What I've done here is I've pulled out a disc from one of the models, and this displays what can happen to a disc. It's called an annular tear. The disc fractures. So what can we do nutritionally? Well, number one, a good supplement that probably a lot of people heard of is glucosamine. And what glucosamine does simply is it attracts water. So it keeps the disc or the meniscus in the knee flexible, pliable. The second supplement we'll often use is supplements that are rich in vitamin A and C, because that supports collagen and rebuilds tissue. And the last one, which is very, very important, is those trace minerals, especially things like manganese, zinc, and copper. And those are important for building integrity and tensile strength into connective tissue. And the only other thing we tell people, you have to be patient. You can inject a torn meniscus with a steroid, and while you may feel better, it's not going to help that tissue repair. Treating it nutritionally will take time, sometimes 4 to 6 months, but you'll feel a lot better in the end. In closing, if you have any questions about this, our information will follow, and we're open to helping really anyone achieve whatever type of health they want. Thank you.
coming up on Wellness for Life.
My name is Karen Lennius. I'm the Becker County Senior Coordinator. I am employed here at MAHUBE-Senior Community Action, and I have some information about senior wellness to share with the community today. I have a variety of topics, and the first one that I want to address is the fact that starting this past July 1 of 2015, there is a statewide Minnesota Adult Abuse Reporting Center. New initiative. It is actually a new system so that residents can call in about maybe neighbors, family members who they feel may not be living in as safe an environment as we know they should be. And that new number, I'm going to say it now, it is a statewide common entry point, available 24 hours a day, 7 days a week, toll-free for general public to access. And that number is 1-844-880-1574. Again, I'm going to say it one more time, 1-844-880-1574. And in my connections with the Senior Linkage Line and Land the Dancing Sky Area Agency on Aging, it is important for me to share that information with community residents, extended family, adult children, and community members in general. So hopefully you will use that if you have a concern about an elderly or disabled neighbor or family member. A couple other things I did want to talk about. We have a very active caregiver support group here in Becker County, and we actually will be meeting later this morning to plan our caregiver event, which we've scheduled for October 1st. If there are any of you out there who consider yourself to be a caregiver, now there's a variety of ways you can be a caregiver. Your loved one can actually be a resident in a nursing home, an assisted living facility, an adult foster care. But if you consider yourself to be a primary caregiver in any way, please know that the events that we plan and the information we prepare is intended for you. I'm going to give you our phone number here at MAHUBE if you would like to be included and receive some very wonderful caregiver resource information. You can call either Karen or Amy here at MAHUBE. The number here is 218-847-1385. And please know that your information will be confidential. We will, however, include you in an invitation to our October 1st event, where we will provide some pleasurable experiences for you and increase your knowledge of resources for caregivers. Okay, that's also something else I wanted to mention today. Another responsibility that I have here at MAHUBE is to coordinate the tax aid program. And just a reminder that property tax and rent rebates can be completed until the 15th of August. So what I want to remind you of is that you need to bring, if you're interested and feel like you need to complete one of those rent or property rebate forms, you can call us here at MAHUBE at the number I said earlier. Actually make an appointment to speak with one of our volunteers, and we can help you get the information and that processed to the state. What you would need to bring is you would need to bring your tax information, income information for 2014 and your property tax statement for 2015. So you bring those two pieces of information with you. We're going to have a day here on August 12th, but we ask that you call our office and let that need be known so we can pencil you in for a time. We need to plan how many volunteers will be here on that day. Again, that's property and rent rebates. That addresses your financial health and well-being as well. Again, call MAHUBE for any questions on any of these programs. MAHUBE Community Action Council here in Detroit Lakes. We have some satellite offices as well, but the number here is 218-847-1385.
Thank you for watching Wellness for Life, brought to you by Purim Physical Therapy, Sanford Health Clinic and Same Day Surgery Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership,